So I'm really happy that you take hair loss very serious. I always say I'll have a tagline that said, um, "Time is follicles." You
Mm.
know how the heart doctors have time is muscle. So if you're having a heart attack, they really rush you to the cath lab and they got to open the arteries and let blood flow through. I feel sometimes the disadvantage of individuals not taking hair loss serious is serious kinds of hair loss go undiagnosed for a longer period of time,
Yeah.
causing that individual a lot more follicles that, as you know, if it's scarring, can't really get those back.
This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Hi, this is Dr. Kate D, and I'm here today with Dr. Christopher Rex. He is a board-certified dermatologist in Arizona, and I'm really excited to talk with him about one of our mutual interests, and that is hair loss therapy. So, a little bit about Dr. Rex. He was actually born in New Haven, Connecticut, maybe a little bit before I went there for school. This was when his dad was pursuing a PhD at Yale, and then grew up mostly in Nigeria, but then came and did college and medical school in New York. He was at med school at Albert Einstein and then did residency at SUNY Downstate, and then ultimately founded Peak Dermatology in Phoenix, Arizona. Dr. Rex, thanks so much for being here. I'm so glad that you're here to talk to me today.
Dr. D, I'm honored to be here. It was just great learning about all the stuff that you're doing, talking about aesthetics and the aesthetics mayhem and stuff like that. So I just feel I'm blessed to be here and looking forward to sharing ideas and talking about this very sensitive topic to a lot of people.
Yeah, before we get on to hair loss, which is really interesting, can you tell us how you ended up going west from New York and your experience in California and then how you ended up settling in Phoenix?
It's a very interesting story. So I was born in Connecticut, as you already pointed out, and my parents were both going to school, and then eventually moved on to Nigeria, moved back home. They're both Nigerians, and the plan was always that we would do our high school in Nigeria, which my sister and I both completed. When my sister was done, she came back and she settled in New York. So she got into some college in New York. So it was just my parents and I in Nigeria. And the logical conclusion was when you go back, you're going to go back to New York. So I had no choice in the situation. I was joining my older sister in New York. So I came there, and while she was going to school, little known fact, Nigeria's economy and the American economy are drastically different when it comes to money, right? So even though my parents were middle class in Nigeria, they would be classified as very poor by American standards. So getting here, I had to work and support my sister. So I was in New York, I was working, she was going to school. And then eventually, about 2 years into it, I realized that I'm going to want to further my education. So I started working and going to school part time. Eventually, I decided, because I didn't know I was going to be a physician, I hadn't made up my mind. I explored a bunch of different career choices in my head. I was thinking I was going to be a full time minister, believe it or not. I was a missionary. I went back to Africa a couple of times. I went to Nigeria, went to Liberia. It was on one of those trips in Ethiopia when I saw how drastic or how scarce medical care could be. One of the translators for us took his kid like a mile, had to take his kid like 2, 3 hours towns over to see it, to find a doctor. It was on that particular trip that I decided I wanted to be a physician. I came back,
Wow.
I started pursuing it, and I ended up getting into one of the most prestigious colleges, med schools in New York, Albert Einstein College of Medicine. And the rest is history.
It, and then you also went into California to
Yes.
establish low income clinics. Is that right? Can you just, what
So
was that experience like?
having made the decision to be a physician on the mission field, I always thought I would take my skills and go back I figured, oh, Africa. I figured I'll do some work here, and then maybe summers or something, I'll do some missionary work, medical missions in Africa. When I was about to graduate as a dermatologist, I got a call from a recruiter from Central Valley, California. So usually
Hmm.
when you think about California, you don't really think about scarcity or lack of healthcare. He was talking to me about a part of California right in the middle, right close and around Fresno, where it's referred to, as many may not know, as the breadbasket of America. That's where we grow a lot of our apricots, our fruits, our vegetables.
Yeah.
So lots and lots of farming. In this area, there are 1 million people for every board certified dermatologist. Blew my mind.
Wow. Yeah.
So here I was about to graduate, and I'm like, at first I was wondering, what am I going to do with dermatology in terms of missions? I figured that there is a place in Tanzania called Mushi that they train, because there are very few board certified dermatologists. They train like nurse practitioners and technicians on skin. I thought I was going to go that angle, but then I find out from this guy that there's a whole swath of this state where I could go and work as a dermatologist and make a difference. So I came and
Yeah.
I worked for a nonprofit in the Central Valley for a year. I helped them set up 2 clinics. And I dealt with a lot of struggle working with the nonprofit in terms of how to set up the delivery of healthcare. Eventually, I handed over the clinic to another doctor, and then I moved to Arizona. So in Arizona, worked for a group for a while, and then I decided I wanted to step out on my own, and I opened my first rural derm practice in Payson, Arizona. That was my first clinic. When I opened the clinic, I was able to go back to the Central Valley and acquire a practice there. So now I take care of people in 2 rural areas, back in Central Valley, California, and here in Arizona, in Payson, Arizona.
Okay. And is that near Phoenix at all, or it's not really Phoenix?
It's about, most people know Scottsdale, right? In Phoenix. When they talk about Arizona, everybody talks about Scottsdale. Scottsdale is like the
Sure.
Beverly Hills.
Right.
It is about an hour, 30 minutes, I would say an
Okay.
hour from Scottsdale, going up into
Okay.
the mountain.
All right, cool. So that's quite the journey across the world. I was hoping that we could go straight into talking about hair loss and how you got into doing more of that. I know some dermatologists treat that and others less. So can you tell me a little bit about the start of your practice and then, what the breadth of the treatments are that you provide?
The beauty about dermatology is, and why I fell in love with dermatology, is it's so broad, right? And I try to stay in every area of dermatology. I am double boarded, so I'm board certified in most surgeries. So I treat skin cancers, right? But I also do, dermatology has to do with hair, skin, and nails. So you have to be an expert in all 3 areas. Being African American, one of the major things we have when it comes to African American female women, hair loss is one of the major issues. We never
Yeah.
really see a lot of skin cancer, even though skin cancers can happen in the African American community. I would say one of the number one things an African American woman would come to me for is hair loss, especially a particular kind of hair loss called CCC. So it's
And
almost
for our audience,
yeah.
CCCA is.
CCCA is central, centrifugal, cicatricial alopecia. Central because it starts on the crown, the vertex. Cicatricial because it's scarring.
Mhm.
Centrifugal because it spreads out like a centrifuge, so
Mhm.
spreads out on the scalp. And alopecia is just a general classification in dermatology that stands for hair loss. So it's really a description of how the pathology develops, the location it develops, and how it spreads. So I was saying that being a dermatologist and being African American is almost irresponsible for you not to
To
have
not do it. Yeah.
not to do hair loss.
It's interesting because I started off doing hair loss treatment because I had a patient who was a nurse midwife who was African American who came to see me when I first opened. And I had been doing PRP for facial rejuvenation. And she had been researching PRP for hair loss. And she had interviewed basically everybody in Seattle who was doing PRP. And she said, okay, I want you to do my hair loss treatment. And I'm like, I haven't really done that before. I'd have to do some research. And she's, okay, do your research. I want you to do it. And chose me.
There you
And
go. She knew
so
what she
I
wanted.
I don't know what the other people were like. Maybe they were. But anyway, so I had to do all the research. I had all the equipment that I needed that which wasn't significant. I knew how to deal with PRP, but I just hadn't treated hair loss. But she's the person who got me almost doing it without, not against my will exactly, but she was like, "You have to do this." So I'm like, "Okay." And I think because it worked so incredibly well on her that I was like, "Okay, this is really a thing."
I'm,
But I'm
I say
yeah, go ahead.
I'm glad you brought that up. PRP. PRP is for the last, I would say, 5 years has been the rave. I know new things have come up.
Well, this was like
Um,
10 years ago
oh, there
so
you
it was
go.
very, very new to me anyway. Most people weren't really doing it yet. But yeah, go ahead.
When I was in residency, this is going to be a funny story. I used to stay away from PRP. Even as a practitioner, I wouldn't say fringe, but there was not a lot of evidence based
Oh
that
yeah.
PRP
Yep.
would work. And you know how they always push evidence based when we're training, like it's got to be evidence based. It wasn't until NYU published an article. NYU actually published an article tracking some women who had androgenic alopecia, and they treated them with PRP. And I read that article and I looked at the pictures. I'm like, you know what, Dr. Rex? That's your evidence right there.
Yeah. It's an N of one, right? Like that. I had an N of one, although I had done at the time. So this would have been 2015. So 9 years
Okay.
ago. At the time, there was a doctor in Florida who had a pretty good comprehensive website and he published his numbers. And
Uh,
his numbers were that it worked in 70% of cases,
wow.
approximately. I quoted her that because I'm like, I don't know. And in my hands, I don't know if it's as good or better or worse than that guy, right?
But think about it from this standpoint. Most people who have hair loss, what did we really have to offer them? It was
Not
like,
much.
hey, you know what? Here's
Rogaine.
some vitamins, here's some biotin, and you know what? Sometimes it's your fault. Look what you did. This is why you lost hair.
Oh,
So there's so many different versions that people got. I feel like it's just great when practitioners take it serious. So I'm really happy that you take hair loss very serious. I always say sometimes if I was going to talk about hair loss, I would have a tagline that said, "Time is follicles." You know how the heart doctors have time is muscle? So if you're having a heart attack, they really rush you to the cath lab and they got to open the arteries and let blood flow through. I feel sometimes the disadvantage of individuals not taking hair loss serious is serious kinds of hair loss go undiagnosed for a longer period of time,
yeah.
causing that individual a lot more follicles that, as if it's scarring, can't really get those back.
They're gone. Yeah, I think I always tell people like if you're already bald in an area, you're not going to regrow hair there,
There
right?
you go.
If you have little fine hairs, you can recruit those and you can make your existing hair darker and
Okay.
stronger. You can grow more hair in an area where it's more sparse depending on what kind of alopecia it is.
Yeah.
But yeah, so time as follicles means the longer you wait to treat it, the harder it's going to be, right?
Yes, exactly. You want to go to someone who's going to diagnose you as quick as possible, or at least rule out the very bad kinds of hair loss.
Sure. So if someone comes to you for a consultation for hair loss, what is that like? And then what are your treatments and in what order?
Yeah, hair loss can be a joy, and it can be one of the most scary, I say, requests. So usually, the best request is the patient sets up an appointment and they say it's hair loss that they're coming in for, right? So you're braced, you're prepared, you go in, and the chart says hair loss. Those are the best cases because the full length of the visit, we're dealing with hair loss. But that's 5% of the time. And that's why I feel like people should realize, not just practitioners, not just providers, patients need to understand that hair loss is important. So most of my cases are patients come in, they're doing their skin check or they have a spot they're concerned with, or have a rash. And we've just
Mm,
spent 15 minutes doing all that stuff. And they're like, so by the way, doc,
yeah.
I'm losing my hair. Oh, that is a 30-minute talk conversation.
Yes.
So what I try to do is in my office is we have a set, okay, this is what we're going to do to work patients up. I try and make the patient understand back from the onset that your hair loss is important, and what we're going to do is try and work up to make sure it's not the bad kind. So my first thing is to take a good history, right? The safest route is to see, is this androgenic alopecia? is could I solicit a history that this is something that happens in the family, probably on the father's side or the mother's side. Some relative at this particular age has thin hair. When they say no to that, you're like, oop, okay, got to go a little deeper. So, my standard workup to rule out scarring alopecia, to really build a foundation, I want our listeners to understand that two major kinds. There is scarring alopecia, scarring hair loss, and non-scarring hair loss. So we need to identify if your hair loss is scarring, and scarring means it's the kind of hair loss where your body or the condition is literally destroying the hair follicles. The hair follicles are, when we think about it, they're the little factories. Every hair has its factory that produces that strand of hair. We have to find out, is this condition destroying the factories? Because once the factory is destroyed, it's gone. We can't get it back. So what I do is, if I feel that there is one location where the hair loss is, I do a punch biopsy. So punch
Mm.
biopsy, when people hear biopsy, they're like, oh my God, you're gonna cut skin. It's really not painful, doesn't take that long. We take a little piece of hair and skin and we send it to the pathologist. Very important to label the specimen alopecia, because if you don't label that alopecia and you say something like neoplasm, and these are for my providers, if you label it neoplasm of a certain behavior, your pathologist is going to cut that skin and hair in a way where they can't even analyze hair loss. They'll be looking
Oh.
towards more, do you have cancer? That once you say neoplasm, is there a growth? So you have to say alopecia, take the biopsy, send it as, because now they will look, they cut it sideways, because now they're
Mm-hmm.
looking at the hair follicles. They're counting the numbers of hair follicles that are in the different phases of hair growth. So our hair, if you have been listening to Dr. D, you probably understand that there are multiple phases of hair. There's hair in the growing phase, anagen. There's hair in the resting phase, telogen. And there's hair that's about to fall out, catagen. Your pathologist would measure what's the ratio. And based on that, they can analyze and say, hey, this individual has androgenic alopecia. It's not scarring, but it's age related, it's genetic related. And we know, okay, this is how we need to go down. On the other hand, if they look at it and they see a lot of inflammation, is just basically your body's soldiers, your white blood cells surrounding all these hair follicles, they begin to think more of, is there a autoimmune condition like lupus? Is there a autoimmune condition like something called lichen planopilaris, lichen planus? Something that's your body's attacking your hair and destroying those factories. We want that data because we're able to say, all right, this person has a systemic condition that is dealing with their hair in this kind of way. We need to try and stop and mitigate the hair loss, or should I say the factory, the follicle destruction, while trying to grow their hair. Meanwhile, on the other,
Do you always do a biopsy, or can you tell often because of the pattern what kind of alopecia it is?
there you go. Good question. So that's why the first part is that history. If I can
Mhm.
elicit a history that points to the fact that this person's hair loss is most likely traction related. Hey, you know what, doc? I had my hair in twists for the last 10 years, very tight twists. Or I had a lot of dreads, tight dreads for 15 years of
Mhm.
my life. If the history points towards something, I can lean on it. But I will tell you one thing. I usually solicit with the patient, hey, if there's a slight doubt that there could be two situations going on, I will say, hey, would you be okay if I do a biopsy? And I'll tell you why. I had a patient come in who, after talking to them, I was thinking this could be telogen effluvium. Telogen effluvium, for our listeners, is a condition where women lose their hair because, not women, anybody loses their hair three
Right.
months after a very stressful event. It could be you had COVID, 3 months later, your hair falls out. You gave birth to a baby, 3 months later, hair falls out. So telogen effluvium is something we know in the medical profession that, oh, your hair is likely going to grow back over time. We just need to nourish it. Something just made me feel that maybe something more going on. And I did
Mhm.
a punch biopsy in the vertex, and she had very early CCCA. I
That's
had
interesting.
never ever caught CCCA that early. She had,
Right.
under my examination, there were full strands of hair everywhere. To me, her hair was full. But
Yeah.
she came in saying, Doc, I'm losing a lot of hair. So biopsying,
Interesting.
I would say, if you feel like you're in doubt that it's not very clearly what you're clinically diagnosing, giving them that extra step just so you can catch something really bad early. It's not that hard of a procedure for a good provider to do, and it's pretty benign. You get them to know, okay, it's not anything bad. And then I work up with labs. The next step would be labs. I want to check thyroid. I want to check iron. There's some other things that people don't really think about before I run into hormones, which I do check the testosterone, the DHEAs, but sometimes it could be a thyroid. The person could be anemic. So I do a detailed blood work to, and then I bring those things together. I start my patients usually up on the generic treatments while I'm waiting to gather that data to make sure it's
Right.
what I think it is.
So, what are the basic treatments you start people on? And then what are the more invasive ones that you do to help stimulate
Excellent
follicles?
question. Excellent. So I'm the kind of person where the way I practice is a partnership, and every patient is treated as an individual. So the first session is really talking about the length and breadth of what is out there that I do and that I know of for regaining hair. So if you were my patient, I would start talking about, hey, you know what? There are supplements out there. You want to make sure you have the nutrition to grow your hair.
Right.
So I talk about neutrophil, I talk visco, I talk about folexin, I talk about biotin. A lot of these would be social economically dependent because the cost of some
Hmm.
of these supplements, not necessarily because one is better than the other. I tell my patients sometimes some of these are the company engages in a lot of heavy ad spend. And when you
Yeah.
have a lot of ad spend, you got to make the money back. Yeah. So it's really about reading and knowing, hey, these things have evidence that grow hair. You want to make sure you're having the right nutrition. Then I move on to what are the pills that can help with the medications. Western
Right.
medicine. So spironolactone has been shown to help with hair growth. Spironolactone is like a medication that is, I feel like it's like a almost like a magic bullet, right? We use it for hormonal acne, we use
Acne.
it for hypertension, but it's been also shown to help modulate hormones and grow
Hmm.
hair. So I talked to them about that. I talked to them about finasteride. Finasteride is a 5 alpha reductase inhibitor. So it really blocks, it doesn't stop your testosterone from being present, but it blocks it from being switched over to what is the active form, hydrotestosterone. So it's a
Right.
blocker of that enzyme that switched it over. So I explain that to patients. I explain about side effects that we know of and those that we don't know that we are anecdotal. And then talk about minoxidil, topical minoxidil. I talk about that. I talk about topical finasteride. So I lay out all the options that I know of, even the cosmetic options. PRP, we talked about PRP.
Hmm.
I recently
Let's go
introduced,
back for 1 second.
yes, yeah.
Do you think that topical finasteride works well?
It's almost like the question if men works well because there are percentages.
Okay.
so,
It just
so it's a very good question, right? Because statistically, they say I believe minoxidil works on 70%, right? I think it's
Mm,
about 70%. So it's 7 out of 10 individuals. How
mhm.
do you know that you're not in the 30% without trying? Finasteride, same, apply the same thing to it. I
Right.
haven't really looked into a lot of the evidence. I don't know if there's been any trials to show if topical finasteride compared to oral finasteride
Or
or
yeah,
compared to minoxidil alone. I don't know of any trials yet, so I would love to look
because
that up
I
and see.
we had a topical. It was Rogaine minoxidil
Minoxidil,
with also finasteride in it.
I have that.
And I thought that worked pretty well in general. The one rare side effect of taking oral finasteride for men, I don't think this happens for women, but sexual dysfunction is a maybe it's 1%. I forget in the exact number, but what is it?
It's super.
It's 2%. Okay. So I my conversation with men is always very different from my conversation with women about hair loss because men can be bald and still be cute and sexy and
If you
whereas
Michael
women
Jordan,
it's a lot harder. To me, the rare but really catastrophic side effect of having sexual dysfunction just because you want to keep your hair to me that was a not a great trade-off.
I feel
But
so. So this, this is what I would give you. So when it comes to men, I love what you just said. When it comes to men and finasteride, this is how I present it to them. I'm like, look, okay. So you're losing hair 2%. I say, hey, 2 out of 100 guys that I give this medication to will say that they had lower libido, lower sex drive. Now, if I took those two and I made another 100, so 2% of those who say they have lowered libido, even after stopping the medication, would say it never went back to where it was. Now, the question is it psych? Because you're no longer inhibiting the testosterone from becoming DHT,
Yeah.
or is it the drug? Because majority of people, once they stop the medication, the libido goes back to where it
Comes
was.
back.
Majority. So I tell my patients, hey, I'm going to give you the medication, especially if they insist. I don't make that choice for them. I'm going to
Hmm.
bring you back in a month and find out how you're doing. And if at any point you need to stop it, you need to stop it. But it has to be the patient's choice. Many
Sure.
people opt for the topical if they're
Right.
worried about that.
Yeah, I totally get that. Let's talk a little bit about the procedures that you do. So we've talked a little bit about PRP, and in my experience with PRP was about, I would say, 70%, maybe 75%
But I
people
want to ask you
responded.
though, how soon do your patients get resolved? Like, when do you tell them to begin to expect? That's really a
Right.
fine line because
I usually tell people 3 to 4 months because you have to be able to see the little baby hairs, and
okay,
they start and you can't see them yet. And a lot of people, it's like the person who cuts your hair who's up there can tell better than you can sometimes that there's new little growth in here. I will say that my very first patient who got me into this crazy mess, she did not notice it first. It was the person who cut her hair, who noticed it,
there you go.
who said, "Oh my God, what are you doing up here?" And she's, "What do you mean?" And they're like, "Oh, you have all this new growth coming in." And interestingly, with her, she was pretty gray at the time when I met her, and the little new growth, the hairs were dark. So it was really cool. And yeah, she was really happy with that. It When she stopped, it went back to the way it was.
My
But so I'm
experience,
curious.
yeah, my
Yeah.
experience with PRP is my first few patients, I would have them come back at the 6 month mark,
Hmm.
right? And I didn't feel a lot of satisfaction. I'm like, my first few patients, I'm like, I don't know, because it's cash pay. And I'm like, I don't know if this is enough. So I actually stopped doing it for a while. My patients are my derm patients, so they're going to come see me for other things. Two of them, a lady and a guy, came back for something else. I think it was a skin check. And I remember looking at their hair. I'm like, and I think this was about the 12th month mark. And I'm like, wait, I called my medical assistant. I say, hey, bring the iPad, pull up their pictures. And
Hmm.
at the 12-month mark, there was a clear difference. They were fuller. And you know that saying, I'm from Missouri, show me? That was my Missouri show me
That's
situation. And then
funny.
I started talking to my patients. I'm like, it could be 3 months, it could be 6 months. But I tell them, hey, if you're going to get results, don't judge it till at least 6 to 12 months out.
Mhm.
Commit to all the treatments because hair
And
grows really slow. Commit to
yeah.
your treatment, be consistent, and give it a year. You did not
And
lose
how
the
many
hair.
treatments do you usually do, and how
So
frequently?
PRP, 3 months. I do one every month for 3 months, and then we wait unless the patient insists. Maybe 6 months in, they're like, "Oh my gosh," or right after, they're like, "This is really great." Then it's a cash pay process. So I
Yeah.
work with them. I say, "How often do you want to do it?" They could do it every quarter, or they could do it every 6 months, really depending on what their budget is and what they want to do. Mind you, they're doing a lot of other things too.
Yeah. I found that as far as how frequent they had to come in, the sweet spot was somewhere between 4 to 5 months, not longer. If they waited 6 months or longer, I found that they started shedding again. And it's different for everybody, but I just was
Yeah.
like, I would tell people this, and you can see how long, and you can figure that out because it is a long term maintenance thing. Have you ever? I can't remember if we talked about Carolase. That's this procedure we started doing a few years ago.
I was very interested in that. I have never
Yeah.
done it, and I looked it up.
Okay.
I'd love to hear your take on it. Like, what do you guys
Yeah, I
experience with
mean,
your practice?
so having gone through phases of pretty bad hair loss in my life, I had thyroid issues really around the time when this lady came in. That's why I was really interested for myself too, but I was very stressed out. I opened this med spa thing and had no income for a year. But anyway, I've had it done. So PRP, you get a blood draw, we spin it down. We use a system that is FDA approved and contained, and is I'm not making my own kit or anything. But so when I first started, the standard treatment 10 years ago or 9, 10 years ago was to not only inject it but also do microneedling on top of that. Then over the next few years, people dropped the microneedling. They're like, just inject it, inject the whole thing all over. So I can just tell you that injecting your scalp is extremely painful. And I tried topical anesthetics, but when your hair is in the way, it's hard to numb your scalp. And I have a chiller that blows cold air, and we would use that, which is helpful, but not really going to
Mm.
numb everything, but it's helpful a little bit. So, anyway, we would do this, and most people were okay. I got people through it, but it definitely is not fun. And so, anyway, at some point, this company, it was called CareFactor, is the product. And the thought was that the reason that around 25 or 30% of PRP treatments don't really work is that everybody's mixture of growth factors is different in their blood. And some people have a higher level of inhibitors. So you have growth factors that stimulate follicles, and then you have some inhibitors of follicles. And your blood might just have more inhibitors than somebody else. I don't know. But this company took basically, they created bioidentical growth factors or analogs and put them in these little nano lysosomes that were very easily absorbed by the skin. And they were only the growth factors, not the inhibitors. And they were like, look, you don't need a blood draw. You can buy this stuff. It's basically the same thing, but you're going to increase your likelihood of success. And then what happened was that company got bought by the company that made this laser that was a very light laser. The laser we already had, this same laser, it's called LaserMD Ultra now. That's the name of it. But it is a non-ablative laser that you can change the energy to like way, way low. So you're just increasing the permeability of the skin. So you're increasing the amount of stuff you're going to absorb by using the laser first. You can also turn that laser way up and use it for resurfacing. But you don't do that for hair. So what you do is you treat the scalp first. So now it's all more, it's increased permeability. So it's more likely to absorb the stuff that you're putting on it. And according to the company, it's 7 times more absorbent. And so then you put the CareFactor on. And the beauty of this thing is it doesn't hurt. So the laser is a tiny bit prickly, doesn't hurt much at all. And then you put the CareFactor on, it's very comfortable. And I started doing this, I don't even know how many years ago now. It's been a while, probably for at least for 5 years, maybe. And I have found that it is not more successful than PRP, but it's about the same. And it doesn't hurt, and it doesn't involve a blood draw, and it doesn't involve blood products. And so I have, for the most part, converted to using that treatment. I still have some people who are like, the PRP works for me. I'm going to stick with that. And it's
Uh,
okay. But I've had both, and I can tell you that I would have 10 Carolays in a row before I wanted to have PRP injected into my scalp.
I will agree with you because people's pain tolerance is very different. I've had patients of
Yeah.
mine who I do PRP on, and I'm like, "What are you, Wonder Woman?" They don't
Yeah.
even budge. And then that the
Right.
patients of mine that the first stick they're losing. So PRP is viable like that. I my
Yeah. And
version
I'm
of
like that second person. I can't, it's hard for me.
yeah, my version of
But
Careless would be TEDS.
yeah. So tell us about TEDS. How does that
So
work?
TEDS stands for Transepidermal Delivery System. Everybody knows about ultrasound, so ultrasound waves, but we usually think about them as capturing images. So you send the ultrasound waves and you capture it and it forms the baby. Alma, this company, has found a way where they use ultrasound waves to open up. So basically, you have this machine that's sending these waves on the scalp, creating microscopic holes for us to introduce these same thing as Carolex. You're introducing growth factors, VEGF, vascular growth factor, endothelial growth factor, FGF, but it's proprietary. So they have different things in there. Some growth factors, they may even have minoxidil in there, but they do not tell. But if you
That's
go on
interesting.
Instagram and you look at the before and afters, I have a couple of patients of mine. I was blown away, right?
Mm,
So it's really about it's same thing. We do 3 treatments just like PRP. You come in, you don't have to shave your hair. The hair gets patted, and then as they drop these the serum, they ultrasound on top of it. As the ultrasounding on top of it, it gets absorbed into the skin, into the hair follicles. You do that once a month for 3 months. Wonderful. A
Hmm.
great replacement, likely the same value price wise as PRP. So I
Yeah.
came up with a little package of mine where I'm like, those who really want to do PRP, we alternate both treatments.
Interesting. Yeah. So it sounds very similar. And the latest thing that's come across for me was just this year is using plated exosomes for the growth factor part. I'm a little bit older than you probably. But so when I was in medical school, we thought of one cell secreting a growth factor and it goes to another cell and hits a receptor and causes a response. And 20 years ago, I believe ish, they discovered that no, that's not really what happens. One cell is secreting exosomes that contain multiple different kinds of growth factors in it.
Yes.
And that hits another cell and causes multiple responses. And so exosome research has been going on for a really long time, actually. And various companies have tried to harness those in order to use them for various reasons, healing, wound healing, and for in aesthetics, of course, we take everything, we just start using it to see if we can get the benefits out of it, even though there's oftentimes no studies. But
Yeah. Yeah.
so the exosome products that have come out over the last few years have all been, in my mind, not super kosher. Okay. So like the quality of them and what they do and what the signals are in them, just because it's an exosome doesn't mean it's a valuable exosome. It could be a more inflammatory exosome. It could be doing other things. And then how the companies are harvesting them and bottling them up. Anyway, so in aesthetics, everyone and their dog wants to be on top of the brand new thing, and they're selling it for $2,000 for one treatment of exosomes. And
Yeah.
so I was very skeptical until a very good friend of mine, Dr. Yael Hollis in New York, she wrote the foreword to my book. Actually, she's a facial plastic surgeon in New York, and she was talking about exosomes on like Instagram or something. And I texted her, I'm like, you're going to have to prove to me that exosomes are a thing. And she texted right back, they are a thing. And here's what you need to look up. And so she sent me all the studies of this one product that they're platelet derived exosomes. The product is called Plated. The
Play.
company is called Rion. And it was founded by these two MD PhDs from Mayo Clinic who are actually cardiologists who had studied this for use in the heart. I know, but they were very entrepreneurial apparently. So they founded this company and they're making topicals. And I have to say the studies for this stuff are just mind-blowingly good. And the we trialed it. We it's just been really successful for skin.
How do you use
And
yours? How do you?
so we carry two of they have an intense serum and then they have a daily serum. So oftentimes what we're doing is we're pairing it with our RF microneedling treatment. So we do RF microneedling for skin tightening. Usually we'll do resurfacing right after that. And then we'll use the intense serum and they can use that twice a day until that runs out, that last few months, and then switch to the daily serum. And it's just been phenomenally successful. So my own personal, again, this is like my experience with PRP is like, wow, it works. But then they introduced not even a year ago a hair serum for with the same exosomes in it. And so I got a sample and this is how they get you, right? And of course, I've been using Nutrafol and the topical that CareFactor makes for the last few years because I swear by it because
Results.
I you probably can't tell, but I have a lot of little new hairs and I like, okay, I don't want them to ever die. So anyway, so I started using that and I really noticed a huge difference. And so I'm like, okay. So my the thing that I have not done yet is use them as part of that procedure. What I've used them for is all the aftercare in the procedure itself. I'm still using the CareFactor serum because price wise to use it would be really expensive, and whereas you're still absorbent afterwards. So I send people home with that the plated hair stuff and then they use that as an ongoing maintenance thing. And so far it's been great, but we just started using that and I don't know, and the company always comes up with studies that are supportive, but I think that I've been in aesthetics long enough to know that every single company figures out some way to create some statistic to support selling their product. And so the
I
proof is
agree with
really
you.
in the pudding.
Dr. D, I would say the proof, you're right, the proof is in the pudding. And as long as providers, we are sitting down, we can only give our patients the best of our knowledge, right? The
Yeah.
best of our knowledge and to the extent. As I said, time is follicles. When I sit down with my patients, what I do not want them doing is going online, paying all these exorbitant prices for things that is just somebody who's tagged hair loss to it and then they're
Right.
selling it. I'd rather have them understand how far the evidence is, and sometimes they still want to try it. We're not doing just one thing. That's what makes it really difficult to answer the
Yeah.
question, did this work or did that work? Is we have the
We're
research so far, but we're going to do multiple things to make sure you get your hair back, to make sure
right.
you keep your hair. And at the end of the day, it's difficult to prove one particular thing unless you go into a study and risk losing more hair and then you
Right.
isolate one treatment. And
Yeah.
unfortunately, there is not a lot of funding because the medical community doesn't see hair loss as much of a problem, right?
Things that are
Cosmetic,
cosmetic don't get covered by insurance, and so therefore there's no reimbursement by CMS or insurance for the procedure.
but is
And
it
so when it's
cosmetic?
cash pay, those studies just don't get done. I actually have a chapter about that in my book about like why there's no studies supporting. I will say that like people like you and me, like we really are doing our best to gather our own experience and our own data. And I'm very honest with my patients about what our success rates are. And it's, you just can't guarantee that you're going to be successful. As with hair loss is the hardest thing, I think. Hair loss and body sculpting, but actually body sculpting is way more predictable, at least with the devices that I have. But hair loss is really hard because you're a human being and like you're going through life. And so you might have another kid or you might lose a parent or you might switch jobs or whatever. And then your hair falls out all over again. And that it is, I think it's the hardest conversation. And I will say that when I talk to patients, so women will tend to do it and they're like, throw the kitchen sink at it, I'm in because there's no way I'm losing my hair. And then men, once they see like the realistic outcomes, they're like, maybe I will, maybe I won't. Some guys will say, all right, we'll give it the old college try and we'll do one series. And if it works, great. If not, oh, but a lot of guys will just say, okay, I'll just deal with it and be a sexy balder guy.
True.
It's hard.
As long as you're a partner, that's what I say. As long as you're partnering with your if you're a provider who partners with your patients and you listen and you find out how aggressive they want to be and you're honest and transparent about what you just pointed out. Some of these things are, I wouldn't say experimental, but there are not that many studies on them. And you're giving them the full length, right? You're giving them, hey, this is what you could do medically, this is what you can do over the counter, and this is what you can do cosmetically. Choose what you can. You start where the patient wants. You take them on that journey. That's what's important.
Yeah. I do think though that if you take a supplement, I personally prefer Nutrafol because I think it's more effective, but I think any of them as long as you have like good nutrition for your hair and you use at least one topical, right? There's a few options, right? And
True.
you do either the TEDS or the Carolase procedure or PRP, you're really maxing out your likelihood of success. And it's really much harder to do just like one and hope for the best. I do have occasionally, I'll have people who like, yeah, I'm not going to do procedures. I'm going to just take a supplement and hope for the best, which is,
Yeah.
it's fine. I have no problem with that. I definitely am not the kind of person who like tries to talk people into anything. If anything, I tend to talk people out of things. But yeah, if you really want to hold on to your follicles, nurture the ones that are left and hold on to them and grow thicker and darker hair. I do think it's possible for most people. But I think for me, as a non dermatologist, I tell them that they have to have had a workup first. Almost everybody coming to me has had a workup. Their
Awesome.
doctors found nothing. All the metabolic workup, the hormone workup, everything's fine. Most of the people walking into my spa have androgenic alopecia. They've been told that. They've been told there's nothing anybody can do. And they read about PRP or whatever. And then they're like, Dr. D, what do you think? is there anything you can offer me? I'm like, yeah, usually there is. So I obviously don't do biopsies. And I basically am relying on the fact that their doc already took care of that workup. Most of them have already seen a dermatologist and they were turned away. Yeah, there's
That's unfortunate because, as I said, a lot of providers, dermatologists included, don't think hair loss is important. Just because you're a dermatologist doesn't mean you have a passion for a particular condition. There's some dermatologists that don't believe acne is important, right?
oh, don't even that'd be a that you know what? Let's do another podcast and talk about acne because I love treating acne,
There you
and I
go.
have found that I have so many people who have come to me and their dermatologist went straight from a spironolactone and or antibiotics straight to Accutane. And they're like coming to me like, is there anything I can do before I start this Accutane thing? I'm like, yes, there is. And almost always we can fix their acne. Almost always.
Yeah.
And
You're talking to a dermatologist who I have no problem with Accutane. As long as you allow the patient, as I said, you have to tell them about all the options. Some patients want the most aggressive treatment because they're getting scars on their face and they want to go to that. But as long as you're transparent about everything, because there's a laser out right now that is very popular. I don't have it it was marketed plainly for acne. And I have a lot of patients who come back after doing that laser and they had several medical spas. I'm like, okay, have you tried this, that, and the other? There's some dermatologists who will start people on oral antibiotics and keep them on antibiotics for a year. Just because a patient went to a dermatologist for acne doesn't mean that they have been adequately treated for their
yeah,
acne.
we could
So
have a whole great conversation.
I
I
know.
think we should do that because, yeah, that's one of my really favorite topics.
I
But
love
we
acne.
are coming close to the end of our time here.
It's
So
just-
I wanted to just like wrap things up and just ask, have you ever had any complications or any negative outcomes from any of the hair treatments that you've done? They've been pretty safe, right? So,
Yeah, none of them. I've never really. I've had patients who couldn't tolerate maybe the PRP, as you pointed out, so we pivoted
sure.
and did something else. But I've never had an adverse reaction. I think for me, the biggest takeaway and the biggest heartbreak for me when it comes to hair loss is when a lady walks in and then she takes off her wig. She's bald.
Yeah.
And she's looking at me and she's really hoping that there's something I can do to get all that hair back. And I'm thinking in my head how to let her know and break the news to her that is very
It's too
late in
late.
the
Yeah.
so the biggest
That's
for
hard.
me is that is the biggest defeat I would say is when it's like you need a transplant and you don't even have enough hair for us to take for the transplant. It's like where have you been? But when it comes to treating hair loss, there may be situations where we don't get enough back because it's been far gone. I've had those, but we do get some, but not
Yeah.
enough to cover the area. I've had those situations, but no adverse effect. No negative outcome.
Yeah. You mentioned transplants. Do you do hair transplants in your practice?
No, I don't personally do hair transplant, but I would love. I have a couple of colleagues of mine, Dr. Ose Tutu in New York. What's his name? There's a doctor in Maryland who are
Mhm.
dermatologists, but they have really taken on the role of doing transplants in skin of color, right? Because our
Wow.
hair is also very torturous. But there are dermatologists who are doing, and they're taking the charge in doing that. But there are people who do transplants as that's their sole
Yeah.
thing. You have to
Yeah.
find someone who really feels comfortable with your hair. I don't do it,
Yeah.
fortunately.
I obviously that is well out of the scope of anything that we do. And I don't have a good person to refer to really for that. I've only had one patient who did it and regretted it. And that was it was a guy and he wasn't really our patient, but he called because he wanted laser hair removal because he had a transplant kind of early on with the dome of his head. And then over time he just went bald everywhere else. And so he was left with this weird patch of hair that was transplanted that wasn't going anywhere. And he actually was looking to do laser hair removal to get rid of the
That's it.
transplanted hair.
Yeah.
Yeah. And which is I don't know, it's like an also an N of one, but I just wonder if you're going to replace your hairline, what happens when it progresses?
That's a
Are you
very good question. And before we close, you got to talk about it. Just because you have a transplant doesn't mean you stop treating your hair loss.
Yeah,
It's not a one or
absolutely
the
have
other.
to.
It's not every
Mhm.
transplant. Any transplant doctor will tell you they still have their patients doing PRP, anything like
Mhm.
nutrition, anything to
Yeah,
keep the donor hairs and to keep the progression of hair
right,
loss. So it's not a
right, right.
one-off where, hey, I got my hair back.
Yeah, exactly, exactly. That's really interesting. It's been already almost an hour that we've been talking. It feels like time has just flown by. It's been great, and I would love to have another discussion about acne. Is there any last bit of wisdom or piece of advice you'd like to leave our audience with?
Yes, if you have hair loss, when you go to a provider, it's very important that you know that the provider, one, acknowledges that you have hair loss, and two, they're going to do everything to make sure they know the diagnosis or the cause of your hair loss. And don't be afraid to try anything that that provider is able to educate you on, because
Right.
you never know what's going to work to keep your hair, right? So those
Yeah.
are find a provider who is willing to listen to you. That's the most important thing.
Yeah, I think that's really great advice. I think that's true of kind of everything in
Yeah.
aesthetics and probably all of medicine is finding a doctor or a provider who you really trust, knows what they're talking about, and you trust that they're working with you and they're not just like telling you what to do. Thanks so much for being here today. I really look forward to our next conversation
Same here.
and I really appreciate all your wisdom about hair loss.
Dr. D, I can't thank you enough. Keep doing what you're doing. This content is really great. People need to hear this. And I look forward to being back on again.
If you've learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. If you have a question or a crazy story of your own you'd like to share, please send an email or voice recording to info@drkatedee.com. That's DRKATEDEE.com. Or reach us through the website medspamayhem.com. And read the book. MedSpa Mayhem is available everywhere books are sold. Thanks for listening. This has been MedSpa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to hit subscribe on your podcast app and leave us a 5-star review. And read the book. MedSpa Mayhem is available everywhere books are sold. Links and more can be found in the show notes and on medspamayhem.com.